Julia.
Hi, Lauren.
It's so nice to see you.
Nice to see you too.
The Detroit Historical Museum.
Such a cool place.
I've never been here,
Oh,
embarrassingly.
yes.
This is fabulous.
There's so much history and so much to learn about our city
Yeah.
and the community. I love it here.
I'm excited to get to see it and get to know you a little bit better. Let's go. Tell me why we're here, why you chose this location for us to meet.
You know, I love history,
Yeah.
and I've always loved learning about where I'm from, and my family in particular. My mom's a family historian, done a lot to research family. My dad was born in the city in 1925 down in Delray. Kind of a childhood of the Depression, and worked at Ford Motor Company early on, and World War II, and just love learning about where we came from, and it helps us figure out where we're going next.
Absolutely. Julia Swanson, our Senior Vice President of Planning and Transformation. What keeps you busy?
What keeps me busy? Well, you know, I spend time looking back at where we've been as an organization and thinking about where we're going to go next. And so helping work with our leadership team across the organization to identify our priorities and track and see how we're doing against them.
It's an exciting time for that.
It is exciting, lots of change.
So tell me about how you got here. Tell me a little bit about your journey, where you started, where you grew up.
Yeah, so I grew up right here right out in Metro Detroit, first ring suburb, Ferndale, Michigan.
Fabulous.
And so really always been part of the community. My father was a city manager, and so always very focused on the community, giving back, watching him. You know, I always thought that I might want to work in healthcare, but was good at math and science, and so got encouraged to consider engineering school. And so I went, I have an engineering degree, but with that had the opportunity to say, how could I apply this in healthcare? And my senior year of college, I was at University of Michigan Hospitals and did a project there. And I also had the opportunity to see on a bulletin board basically a sign for an internship at Henry Ford. So I was actually an intern in one of the departments that I lead now. So what is now called Transformation Consulting. It was called Operations Analysis Management Services at that time. And so I was an industrial engineering student in that department. And so, you know, now when I meet with the interns who come in, I get to tell them the story about where I started.
You take the moment to really let this all soak in and think about not just our history and how we played a role in this city 100, 115 years ago, but how we continue to play a role in the community.
So important.
Right?
Yeah. I mean, we're such a big employer. We, the investments we make, the decisions we make every day can advance the community. And so how we help support local businesses, how we are always looking at not just what the community needs from a healthcare perspective, but the other things that surround that, whether that be housing or food needs or different things like that. We play such an important role in not always doing it ourselves, but finding the right partners so that collectively as an ecosystem we can care for those who count on us.
Tell me a little bit about your day-to-day. What are some of the projects that you work on? Kind of give people an idea of what your life looks like at Henry Ford Health.
Yeah, so of course I spend a lot of time in meetings. But I've had the opportunity to work on projects from opening up new hospitals. I was on the leadership team that opened West Bloomfield, to working on different improvements, to helping organize our response to some of the COVID work. Now I spend a lot of time really kind of thinking about what the future is going to look like, and helping work with our leaders around where they are, where they're going to go next, how do they make sure that they're thinking kind of the future of health and where we're going to be, but what are the next steps to get there, and helping them put those multi-step plans in place.
So there's an old-time pharmacy.
You can think about the pharmacies we have today, and it's interesting actually. Not only our storefront pharmacies, but all the automation we're putting into our pharmacies.
Yes.
And compared to this, and
oh my gosh,
how it's changed over the years. Talk about transformation.
We've come a long way.
We have come a long way.
Yeah,
We've come a long way, but it's so cool.
What about healthcare excites you?
Oh, I think the fact that we have such an impact on people's lives. Personally, I've had a lot of experiences myself, and so I can see from the patient perspective, and I can see how impactful the work that we do is, and also where we're going. So when I think about the availability of care and how we can meet people where they're at and provide information and peace of mind to people and answers in a way that is going to become more and more easy to meet them and provide information that people need. That's exciting. I think there's so much potential in terms of what we can do and where we can focus.
What are some of the lessons you've learned along the way that have really stuck with you over time?
Oh, there's so many. I think really being a good partner, being collaborative, and showing up knowing that I don't have all the answers, but I know that amongst the team and the diversity of all the different people who come together, we can come up with some great solutions. Making sure that you stay close to the front line, that you don't try to decide things from an office building, but really go back to the people who really know how things work is so important. To give myself grace and to give others grace, and to realize that you can often learn as much from what didn't go well as from what did work, and then to apply that moving forward.
You know, you're in planning and transformation, so I'm really interested with this next question is, how do you see the future of healthcare from your unique perspective? Where is it headed?
Yeah, so I already talked some about consumerism and how we are engaging consumers, and you're going to see in our next strategic plan a big focus on that, and that's something that we've heard loud and clear from both externally and internally, that we provide excellent care. We are very take care of people, keep them healthy, get them healthy again. But and we have so many good patient experiences, but that the needs of the consumers and what patients and members are looking for is really changing. And so how we thought people wanted to receive care, how they wanted to access care is different in the future. And it's different now, and I think we're trying to catch up. And we've done a lot to put a lot of things in place, but I think that's going to be a key focus for us.
When you think about a place like this, that really you could come to one place and get everything you needed.
Exactly.
There's something about that with healthcare too, right, that we're aiming for.
Right,
yeah.
Right, and making it so it's not so complicated to navigate. And while it might not all be in one location, there's one way, one number you can call, one website you can go to, and you can get what you need. And so that's what we have such an opportunity to do, is even though we in many ways are all one system, we still have disparate parts, and how we can help connect that together, put ourselves in the patient's or members' shoes, and make it easy for them to use the services we have. That's where we have so much potential.
Yeah, the opportunities are endless.
Yep.
I'm really curious what you would say to a young woman who's just starting their career, or somebody in the middle of their career, about how they can make the best of the track they're on and see their future. What would you say?
Yeah, I think always reinvest in yourself. So when you're really busy and you feel like you've got too much going on and you don't have time, don't stress out too much about the day-to-day or about a meeting or an encounter that maybe didn't go exactly like you wanted it to. Learn from it, but take that long view and look back, but look forward, and above all, just give yourself grace.
So important. Thank you. Julia Swanson, our Senior Vice President of Planning and Transformation. It has been a very, very big pleasure for me. Thank you so much.
Thank you.